Now, Thomas Engels, Administrator of the Health Resources and Services Administration. Tom, thank you so much for joining us. Come on up.
Thank you.
How are you today? Thank you for being here.
You know John Schneider?
This has been a bit of a marathon. Have you guys ever met?
No, but he, one of our staffers works with him.
Oh, really?
Dr. John Schneider, yeah.
Oh, that's great. Well, when I thought that, wow, we're talking about the last mile, closing the distance between where the technology lives and where the patients are, I thought it wouldn't hurt to have one medical there because it's kind of in your space. It's kind of, similar along that way. But I do think, largely as, HHS is kind of looking at, how do you reach people wherever they are? And I know that's you've got a whole country to deal with. What are your, biggest, challenge points right now, speed bumps to achieving your goal?
Well, the biggest challenges that we have is that HRSA the Health Resources and Services Administration, has some of the very unique programs with all of HHS. We have programs that serve people in urban and rural areas, and they serve a very diverse type of population. It could be anybody can go to a federally qualified health center. So it could be somebody with a high income, but it could also be somebody that has zero income.
Right.
So the biggest challenges that we see with those individuals is how do we keep them coming back for care, and what sort of technologies do we have? Because the federally qualified health centers need to follow a budget, just like every other health system has to do.
And can I read this data for folks? HRSA, so 31 million people, 1,400 health centers, 15,000 sites in underserved and rural communities, providing primary care services regardless of pay. It's a backbone of the health safety net.
And actually, I can update you in some of those numbers. We're actually up to 1,395 federally qualified health centers that operate 16,000 sites across this country. And this year, we're going to announce that they're actually increasing new patients by 1.1 million. So we're over 32 million patients that we're seeing at a federally qualified health center.
So when they come to see you, what can they come to see you for?
Anything. That's the beauty of the health center, is that it is no different than any other any other health system that you have in this country. The big thing that they really challenge on is that we offer behavioral health services, we offer dental services, we offer primary care services. The health centers are leading the nation when it comes to hypertension and diabetes adherence rates for the populations that they serve. They exceed those averages by 7%. And the reason they are able to do that, they know their communities. Every federally qualified health center has to have a board of directors that is made up of 51% of the individuals that either use the health center or come from that community. They know their community. They know what they need to offer in their community in order to offer good, comprehensive care.
So when it comes to a lot of the technology and kind of new bold bets in advanced bioscience that we're talking about today, how hard is it to take those new developments and pay for them and have them and deploy them where you're at? Or is there a gap there?
There is a gap. I mean, again, the federally qualified health centers receive anywhere from 8 to 12% of their budget from HRSA, from the federal government. And then they make it up through various options, 340B, through insurance plans, whatever it might be. So it's a challenge for them. But some of the challenges that they really try to incorporate are systems like telehealth services that they can offer. And we really incorporate a lot of telehealth services across all of our federal health centers. 97% of the health centers that in this country utilize some form of telehealth services. And a number of them offer somebody for behavioral health or psychiatric type services, substance use services, can all utilize a telehealth type system. I come from a rural area in Wisconsin, and without a telehealth service, my mom was a hospital administrator in Lafayette County, Wisconsin. And one of the big challenges that she had back in the 70s is still here today is health workforce. And that's another thing that we have to incorporate. When we use technology like a telehealth service, we need to have a technology or a federal workforce that actually matches that. And that's a challenge for HRSA that we need to change.
Thomas, I have to say, meeting you is a really interesting experience because it's demonstrating my own ignorance about what the pieces of the health. I mean, I'm much more familiar with One Medical and out there, and we've been interviewed lots of hospitals around the country, community health hospitals, and others that have different roles. And I did not know that the backbone of what you had was so large. I do a lot in the Appalachian region. Gail Manchin, so the wife of former Senator Joe Manchin, is co-chair of the Appalachian Regional Commission. So she's constantly looking at, I think there are 19 states in the Appalachian region that are sort of in what you would call underdeveloped or under-resourced areas in a lot of this. But I do know that, you play a key role in a lot of that. But so I guess my unfair question is, what can we do to help HRSA be better known?
I think we're more well known than you actually believe, and the reason is because people.
It may be a function of my own ignorance.
No, it's not a matter of your own ignorance. It's because we have so many very varying type programs. For example, we have the Ryan White program, which 91.4% of the people that go through the Ryan White program that have been tested positive for HIV are 91.4% are virally suppressed. Another program that we have is the organ transplantation program. We have and so all of the issues that you've been hearing and reading about with some of the issues that have been going on with organ transplants, that goes through the Health Resources and Services Administration.
Wow.
We work in cooperation with CMS. But then we also have the Federal Office of Rural Health Policy. We operate telehealth services through our Office of Advancement of Telehealth. We have Bureau of Health Workforce. We have a number of programs that actually all work together. And one of the first challenges that I did when I came to HRSA this time around, and this is my second term at HRSA.
I should tell everybody you're a pharmacist too, right?
I'm not a pharmacist. I work for the pharmacist.
You were head of a pharmacy association.
Yes.
I had Buddy Carter up here, who is a pharmacist.
And he and I have actually met and talked about this. But the really unique challenges that we have is that we have all these very unique programs that come together. But the big challenge that I wanted to make this time around is I've applied what I call the One HRSA approach. I want to make sure all of our programs work together. So whether we have a home visiting staff going out and visiting with a newborn mom with an infant, I want to make sure that if they're going to that home, they actually, if there's a 14-year-old there, they know how to help that 14-year-old get that individual into services. If there's a grandmother in the house, can we help that grandmother get into various programs that HRSA does offer? We approach everything with a One HRSA mind. Let's all work together. We think it's a more efficient way to bring about services.
So Will is using AI agents and AI help bots in their website. They've got a great website. You go in, and even someone like me who's phobic likes it. and you have that. Are you finding technology interfaces and AI platforms or various tools and techniques useful in interacting with the audiences, the patients you're dealing with, or I should say the citizens you're dealing with, or is that yet to come?
It has been a challenge. 99% of the federally qualified health centers have some sort of an electronic health record system.
Right.
But some of them don't talk to each other. For example, I was in Hagerstown up in northern Maryland, and their primary care healthcare HR system and their dental system can't talk to one another, even though they're in the same building. So we're trying to help them find ways that we can use AI or other means of technology. Health centers have the biggest challenge they probably have is trying to fund these sort of things. We're working with them. We're trying to find opportunities. We're working with our partners in Congress. We're working with the President and Secretary Kennedy. All of us understand we need to make sure that we're getting as much resource out to these federally qualified health centers because the numbers keep going up. Last year, we only served 31 million patients. This year, we're going to announce that we're serving 32 million patients. So it always increases. We know the great services that they offer, and they do a fantastic job at it.
How many patients do you have?
About 1 million.
About
1 million.
1 million. So staggering.
Yeah.
What lessons from the membership fee only, club in One Medical, which I love? What are some of the things when you hear what he's got to do and the extraordinary footprint, which I was just completely unaware of? I'm interested in giving him some consulting services of you for free.
Well, that's what jumps to mind as I am listening to you describe that is what role autonomy might play in the clinical space. Because how many of those interactions of those 32 million lives are things that are low complexity, that there's highly protocolized medicine available for, that currently you're having to take very precious clinical resources to address. Things like sinus infections, urinary tract infections, stuff that's not requiring high thought processes, and there's very well-established approaches to it. If we could address that for pennies in a matter of seconds instead of even through the HRSA model, it's still, the care is expensive, and those resources are so finite. And so what impact could we have if we took that layer of care and made it super convenient, super cheap? I think that is a necessary thing for the One Medicals of the world, the Amazons of the world, but just as a country as a whole, what would that do for the just deflationary impact on the cost of care overall?
And one other element, Tom, when I had Chris Klomp up here, when you're sort of thinking broadly about changing the health profile, if you can impact the health profile of much of the country, if you're able to decrease obesity, let's decrease other comorbidities in the system, I mean, you're going to feel and see that far more soon. Soon, if we're hitting the audience, now your audience that you're having come in is probably mostly out of the traditional healthcare system, right? And they're in these other areas. But in my book, if we're not somehow impacting the community that's in your areas, then you're not really changing the health profile.
And again, that's the beauty of the federally qualified health centers. Yeah. They know their communities, but they have the same challenges that the doctor was just talking about. We have to make sure we have the right workforce out there to help the telehealth systems within a federally qualified health center. But we also have to meet the challenges of a changing society. Right. 1 in 15 seniors use a federally qualified health center. In rural areas, it's 1 in 5 people in rural areas use a federally qualified health center. We're getting an aging population, and as that population ages, the needs of those communities change with it.
Wow. I need to have you at some of the dinners and whatnot that I'm organizing in this space. But again, in the spirit of our last couple of minutes here for both of you, if you were to have, I don't know, more resources, or if you were to have new partnerships, if you were to have some other element that added to, the success profile of what you're doing and the bold bet spirit, what would that be?
Well, everybody within a federal program is always going to say they want more money. But
I tried hard to get some other people up here, and they said, we like the president's budget.
And I do like the president's budget, because the president's budget and the secretary's budget is actually advancing everything that we're trying to do. Right. The MAHA approach, Making America Healthy Again, is working. We're taking Secretary Kennedy's nutrition approach, and we're using the resources that he is providing and the president is providing to advance that initiative. Through increased in a better nutritional education, we're going to reduce incidences of chronic disease. The federally qualified health centers are already doing that. We're seeing reductions in the number of hypertension, and they're actually, where patients are adhering to those plans, and diabetes, we're adhering to those plans. And by having an improved nutrition, we're going to see reductions in kidney disease throughout the country. So we are taking the president's resources that he has provided to us, and we're using them to the very best possible.
What's one more thing you want, other than the nutrition?
I want to follow the president's initiative and the secretary's initiative. We are going to end the HIV initiative, or HIV epidemic in this country. The Ryan White program is already at 91.4%. That's half the patients in this country with HIV. We're going to take that initiative. We're going to advance it. We are going to end the HIV epidemic in this country.
Fantastic. Thank you.
Thank you.
I'm on board. Will?
Can we help with that?
Yes, you can.
All right, perfect. Yeah. I would think, just going back to that idea of autonomy and just the sea change in the deflationary impact it could have across the healthcare system, having more sandboxes and places to test that and demonstrate that it's safe and effective is really a constraint at the moment.
Well, what a pleasure to have you both here. I hope you'll both hang out till 5. You're committed to it. Thomas, I hope you will stay here till 5. Maybe. I mean, you're in a big official. You've got a serious tie on and all that. So, But if you want to hang out till 5, I'm buying. Actually, BD's buying, but that's okay. Please give a big round of applause to Thomas Engels, Administrator of the Health Resources and Services Administration. I want to thank you, because I always measure this. I said to everybody, I was quite honest, that today the reason I'm doing all these interviews, I'm trying to educate myself, and in addition to some others. But I really appreciate it, because I did not know the degree to which you provided such a health net backbone in the country, and I hope we can continue to work together and have you back. And Will Kimbrough, Senior Medical Director of Clinical AI for Amazon Health Services. Thank you both for joining us. Thanks so much. I really appreciate it. Thank you.